Thanks, Megan. So I'm going to do something a little different. My talk's in there, but what I'd like to do is first ask a couple of questions. How many people in the audience right now have hip or knee arthritis? Whoa. I guess maybe a dumb question. One of the things that there was actually an article out just this past week where a group of researchers followed a community of about 10,000 people for their lifetimes, and their statistics were quite surprising in that 1 out of every 2 people, 50% of the population, developed knee arthritis by the time they were 80. And it was a little higher for women than men. So, and this was all just a whole community. So it gives you an idea of the kinds of things that we're dealing with. How many people in the audience have had a hip or a knee replacement? It's about half. Every year in the United States, there's about 400,000 patients that undergo a hip replacement and about 650,000 people that undergo a knee replacement. It used to actually be the opposite. Hip arthritis was more common and requiring surgery at least until about 4 or 5 years ago when knees all of a sudden overtook hips as far as the other. And then a lot of people think that is because of the activities. Everyone's become more active. Injuries from sports, yep. All play a role in developing that, but literally over 1 million people a year just in the United States have that kind of surgery. Now, one of the things most telling to me when we did a lot of our background work for education is there was a study from Duke University that said that 70% and a little over 70% of the people that had documented end-stage arthritis with pain never sought treatment. Never. Not even going to the doctor's office, not going to try it. That meant 30% of the people at least went and explored that. And we started thinking about why would someone want to live in pain and live in disability and all the things you heard about when there's all these good things out there. Non-operative treatments, operative treatments, certainly surgery for people that have had it know that it's really a life-altering experience in many ways. But what they discovered is that there's a very high level of anxiety associated with not only having the disease to begin with, but thinking about getting treatments. And obviously there's always anxiety about surgery for any area. But from our perspective, when we see what we can help patients with, why don't more patients at least seek opinions on what can they do for their hip or knee arthritis particularly? And the number one reason, and through our program, we're always talking to our patients and surveying them, it is their anxiety about the treatment plan. So several years ago, we developed a methodology. It's called patient and family-centered care. Although that sounds like an abstract term, it's actually a whole different approach to the delivery of care in which the number one goal is to examine the care experience of the patient through the eyes of the patients and their families. Not the doctors, not the nurses, not the administrators, not anyone. And when you do that, you sort of change completely the emphasis on where you put your resources to treat patients. We started this in our practice many years ago, and then our program here in orthopedics is certainly based on that, which I'll talk about. But we actually have also exported these ideas to other areas. So it's not just limited to orthopedics by any means. For instance, the breast care program here and the gyne-oncology program here are based in the same principles if you've come through. We also adopted or started a program up at Presbyterian in Montefiore on the whole day of surgery experience. We have a project up at Presby on examining the experience of a level 1 trauma in patients that come in by helicopters that have accidents and things. So it's a whole different way of approaching the way you deliver care. So what I'd like to do today is sort of, we put working groups together. They're made up of every person that touches the experience of a patient. And my first challenge to all of our working groups is to write the ideal care experience for the patient and their family. And the reason for that is, all of us in healthcare, we sort of have our own biases and our own ideas and all. But we all want to aim for the ideal in the end. We want to tell the story of a patient and family's experience the way it should be, not the way we're limited maybe in what we do. So what I'd like to do today is sort of what we have done in our group is tell the ideal experience for someone that has a hip or knee arthritis that may require surgery too. So I'm the patient. I'm at home. I've been sort of very active. I played football. Had a couple injuries. Nothing bad. Never needed surgery. I like to exercise. And all of a sudden, I started getting a little bit of pain right here in the groin area, and on the right side, and on the left side, right on the inside part of my knee as well. And it sort of just ignored it for a while, kept going, took some medicines every once in a while, still exercised, still did the kinds of things. But all of a sudden, I wasn't able to run anymore. I'd get out and you'd run, and all of a sudden, it'd feel like a groin pain in the middle of a run. You just couldn't do it anymore. So that was fine. I was getting a little older, wanted to do some other things. So I took up biking, did some low impact stuff. Hate medicines, don't want to pollute my body with all that kind of stuff, but still exercising. All of a sudden, at nighttime, it seemed like when it wasn't working, both these areas in the groin and the inside part of the knee got worse and worse. And the morning times when I tried to get up, it took about 10, 15 steps before I could really even get going, and just sort of loosened it up. Again, once I got going, it wasn't too bad. You just keep going, ignore it, do the kinds of things you have to do. Well, one day we were out walking around, and all of a sudden someone said, "Aren't you limping?" And he said, "No, I'm not limping." "What are you talking about? It looks like you're walking a little hunched over too." "Nah, just nothing. Just keep going." Well, it gets on, and all of a sudden I find it's a little harder to put my shoes and socks on that side. It's a little harder to sort of cut my toenails on the other side. It's a little harder to go out and, take the garbage out. It's a little harder to go to the mall and walk around the mall without thinking about my joints. Whereas before, you just sort of did it, right? All of a sudden, people notice the limp a little bit more. There's a cane at the house, and I never thought it was grandma's, from before. Started using the cane, and it actually helped feel, especially the groin pain. It really helped as I walked around and did those kinds of things. But all of a sudden, I don't want to go out of the house anymore. I certainly don't want to bike anymore. I'm starting to think about my joints more and more. It's a little harder to get up from the chair, especially in that front part of the knee. Steps are a killer. Steps are just a killer, especially when I go out of the house and I have to walk down a hill. I have to start going on sideways. I actually have to go backwards sometimes. And so things are definitely changing. And I really don't know what's going on. It's right in the inside part here. Another person told me I was watching you walk from behind, and it looks like you're a little bow-legged on that side, too. Don't know what they're talking about. So all of a sudden, one morning I get up, and I just can't even get out of bed. It's just in the groin, and those first 10 steps just don't work anymore. And I can't do those kinds of things anymore. So I got to call the doctor, I got to break down and see what's going on. I tried a little Aleve, a little Advil, that kind of, and it helped, but, it still wasn't the kind of thing that let me do the things I want to do. And I'm thinking about my joints the whole time. So I had to call the doctor, call my orthopedist. Surprise, I can get in probably about 2 weeks to see the doctor. Well, that's great. They asked me a ton of questions on the phone, though. A ton of questions, although a lot of them were appropriate because, I did have groin pain. I couldn't walk a half block anymore. I can't do my shoes and socks and toenails. So even though they asked a lot of questions, they seemed to be pertinent to what, I need. Do I have back problems? What has that got to do with my hip and the knee? And they asked some